Home birth versus hospital birth. If you're under the care of midwives in Canada, you have the option of choosing either as your birthplace. Many also have the option of choosing a birth center depending on your location, but in today's video, I'm focusing on the difference between hospital and home birth, what you can expect and not expect for each, and how you can make the right decision for you and your family. Let's get started. Hi, I'm Ashley, and I'm a doula, a birth photographer, and a childbirth educator in the Greater Toronto Area, and I'm extremely passionate about informed and empowered birth. Make sure you subscribe to my channel so you don't miss any tips, tricks, and advice to birth and parent like a boss. Each birthplace has its own benefits and its own setbacks depending on what your personal needs, wants, and preferences are. So let's get into what some of the differences are between hospital and home. By far, hospitals are the most common place to give birth, though this is changing somewhat, especially with the current COVID-19 pandemic and many more restrictions on birth in hospital settings. Toronto itself, where I'm from, has 10 hospitals with labor and delivery units within the city proper, and another 10 plus options in the immediate Greater Toronto Area. That's a lot of options, and you don't need to birth at the hospital closest to you if you're willing to travel. All high-risk births will be directed to hospital under the care of an obstetrician. Within the hospital, you'll have the option for an epidural or narcotics for pain relief, but other more natural comfort measures can really be hit or miss depending on the hospital. Many have jacuzzis or birth tubs, but most will not allow you to actually give birth in the tub, so water birth is pretty much out if you birth in hospital. In fact, there is only one hospital in the GTA that currently allows water birth, and if you're in the area, that would be Scarborough General Hospital. However, another caveat is to check with the hospital before making a decision on birthplace if water birth or hydrotherapy is something you want to try. Because with the pandemic, many hospitals have tightened restrictions on hydrotherapy, period, which means water birth would definitely be out. It's also important to note that for those hospitals that have tubs for hydrotherapy, often they are in limited supply, particularly if it's an older hospital. The tub may not even be in the labor room, and they can be on a first come, first served basis. So it's not always a guarantee that it will be available for you if that's the case. The great thing about hospitals, though, you are exactly where you want to be in the case of a true obstetric emergency, which is rare. But look, shit happens, and we usually can't predict who it will happen to. Hospitals have all the resources and tools at hand to keep an outcome from going too far south. The biggest downside to hospital birth is that you are more restricted when it comes to things like how many visitors you can have at one time, and some may even still be trying to restrict eating and drinking. Anything other than clear liquids, even though, by the way, this is not evidence-based. Now, if you have midwives and a low-risk pregnancy, you also have the option of having a home birth. There is something to be said for being able to labor and birth in the comfort of your home, but it's not for everyone. For one, at home, you won't have the option of an epidural or narcotics for pain, and in the event of an emergency, you would need to transfer to hospital, usually by ambulance. For many, though, home birth is appealing because home is a safe, comforting, and familiar place. And that's exactly the ideal environment for birth. As well, the benefit to being in your own space is that to a much greater degree, you call the shots. So if you want your whole family there for your birth, by all means, go for it. And certainly you won't be restricted for trying a water birth in your home. So how do you choose which option to go with for your birth? Ask yourself the following questions. Am I low risk or high risk? Being high risk will likely predetermine that the safest place for you to birth is in a hospital setting. What kind of comfort measures are important to you? Remember, epidurals and narcotics are not available at home, though if you did want to transfer for pain relief, that is totally okay. In fact, one of the primary reasons why people transfer to hospital from home is for pain relief, with the other reason, by the way, being failure to progress. How technologically inclined are you? If you want to be surrounded by more technology because that makes you feel safer, the hospital is the way to go. Though remember, midwives do have the skills to manage most obstetric emergencies and certainly the most common ones. If, on the other hand, you feel that you would rather have a birth with fewer interventions, your best bet is probably home. There's a saying that I heard somewhere, I can't recall where, but it has really stuck with me, and it says, stepping foot into the hospital is the first intervention when it comes to birth. So maybe something to consider. How much planning do you feel you can do? There is kind of more to do to prepare and clean up at a home birth. What's nice about the hospital setting is that you can show up in labor and everything else, for the most part, is taken care of for you. You don't have to think about making sure you have enough towels and covering your mattress in waterproof covers and old sheets, or setting up a birth tub and keeping it heated if you decide to go that route. Finally, one of the most important questions to ask, where do you feel safest? This is different for everyone with no right or wrong answer. Ultimately, the decision that you feel best about is the decision that's right for you. Do your homework, go on a tour of your hospital's maternity ward, weigh the pros and cons, talk to your care provider, and make the decision that is best for you. And remember, nothing is ever set in stone. You can always plan for one option and change your mind, and that includes during labor. Let me know if this video was helpful for you, or if you have any questions on anything that I didn't cover or you want more clarification on, pop it in the comments below. And don't forget to grab your free printable birth affirmations from the link in the description. And of course, if you want more doula tips and tricks, make sure you subscribe and hit that like button and share with anyone in your life who's pregnant or a new parent. Thanks for watching, and I'll see you on the flip side.